back, man. 2 minutes past the top of the hour, man, and what a bright moment we have in our studio with us, man. I think two of the leading wellness, especially young leaders in this country right now, joining us for this Tulane University Town Hall conversation with the studies that are underway to help us recover and readjust, Blair, from COVID, this RSV discussion, respiratory syncytial virus. I want to welcome to the studio Mr. Florence K. Numbi, Clinical Research Coordinator at Tulane University, and, of course, the great Blair Williams, Clinical Research Nurse. Guys, welcome to the Good Morning Show.
Thank you.
Thank you.
Happy
Thank
to
you
be
so
here.
Yeah.
Well, we're happy to have you guys here. Florence, if you don't mind,
Florence.
if I can start?
Yeah.
With our superstar over here. Blair, first of all, what is RSV? Why is this discussion important, especially where we're dealing with the last couple of years with COVID? And who is Blair Williams, and why this commitment to health and wellness?
So I'll start out with myself. My name is Blair Williams. I am a nurse. I was working in a critical cardiac ICU at Children's for about 3 years before starting working at Tulane. And I've been in the research world for about 1.5 years now. And I think being a clinical research nurse, you just get to see a lot of things coming into action from the ground up. And one of those things would be the RSV study that they have going on now. RSV is just a respiratory virus. Usually when it starts out, you get symptoms very similar to the cold or the flu. But I have seen it specifically in pediatrics affect children kind of severely. They can just go from having cough, runny nose, just your typical symptoms, to being completely intubated. And I think it's been focused on a lot in the pediatric community, but now they're trying to raise awareness about it in the older adult community as well, because it affects them too.
And the special partnership you have with Tulane, I mean, as a clinical research nurse, you could have aligned with any other medical hospital. But to talk about Tulane, and it's important in the role that it's playing with the work and research you do.
I think Tulane is just a great facility. They are known for delivering great medical care. So I thought that would be a good place for me to go as far as really getting in on the ground phase of things to figure out what was going on, what new treatments they're looking at, and what areas of medicine they're looking into as well. And Tulane has a variety of research studies going on right now. That kind of impacts a lot.
What you didn't say is that you're a home girl. Too. You know.
I am.
Hold on. Let's ring that bell. Tulane, home girl, from New Orleans, moved to Shreveport.
Yeah.
After Katrina,
and then after school, came back. Had to come back home. And haven't wanted to leave yet, so I'm still here.
And you say pediatrics your specialty?
Yeah, well, it was. It was one of the areas that I worked in, yeah.
So other than pediatrics, what is it about clinical research that you like?
So let me tell you, I feel like research has always been a huge part of my life. My mom's a dentist. She used to work at LSU School of Dentistry.
It's in you.
She was, very heavily involved in research. She loves her research. So it's always been something that has been thought of as important in my family.
Well, give Mom a shout out now.
Dr. Andretta Porter Williams.
Okay.
Yeah, she is in Lafayette now, working at Tesh Community Clinic.
So the research part of it, because we know nurses as practitioners, and caretakers, man, but we forget about that side of the research that nurses do.
Yes, and I honestly, there are so many things that you can do as a nurse. And I was shocked to even hear that a clinical research nurse was even a thing. And then when I started looking into it some more, I was like, this is kind of cool.
Right.
This is interesting. And it would be great to work in this field to see what it's about. So
Now you're talking like somebody that's been around for a long,
I
I'm looking at you. You look like you 16 years old,
Oh,
right?
thank you.
I'm
I love
here,
that.
went there, but back here. How long, as Blair Williams? How long have you been doing research?
just a year and a half.
Oh wow!
Yeah, still new in it, but learning a lot every day.
Well, and we forget about the researchers. And I can see here that you're not comfortable being in the limelight because most of our researchers are in the labs. You guys are doing that micro work, right?
Behind the scenes.
That behind the scenes. But isn't it good, though, to see that researchers right now, especially given what we're dealing with, these worldwide diseases and, some of these pandemics, researchers are finally getting their due.
It is. They are. And I feel like the research community has not had the greatest reputation historically.
And y'all are cleaning that up.
Oh, yes, we are. We are definitely
especially with
trying
all the misinformation.
Yes. We're definitely trying to.
Thank you for admitting that, and to see that we can have, especially young people of color, that who are committed not only to doing the research, but making sure it's the right research for the right information. Misdiagnosis, bad research can affect people's lives.
Oh, yeah. Especially, I feel like within the Black community and just our history with the Tuskegee trials and all of that. I know a lot of us within our community don't necessarily trust research. And
Ring the bell.
we don't trust it. And so for that reason, we haven't been involved in it, or others haven't involved us in it. And so how our genes act and our genetic information and everything is not included in a lot of the treatments that we have today.
Well, I'm going to have to segue now, Flores. She's talking about genetic information and genes and stuff. She Blair done got comfortable, right? She's flying all over my head. She's flying all over my head into the lab. Man, but a segue to you, Flores K. Newby, one of the leading clinical researchers in this country, and your association with Tulane. First, before we talk about who you are, or why this commitment to research, talk about how good it has to make you feel to see a young researcher, an analyst like Blair.
Oh yeah, I love it really because right now, as Blair say, a Black community has been left behind. When it was about research, and now seeing that even people like Blair taking part, like conducting research, and this bring more trust, within Black community. And it helps a lot.
So now we've stuck our chests out about Blair Williams. And Dr. Williams, if you're listening, baby girl she's doing her thing. Who is Flores Numbi? What led you to this commitment to be a leading researcher?
Yeah, first of all, I'm a medical doctor from Congo, and I'm a certified clinical research coordinators, and I did first of all my master degree at Tulane, and while I was doing my master, I was working in a research project called Check It, and the goal of that research project was to screen young African American with to check if they have chlamydia or gonorrhea, and to offer them free treatment. And that's when, what brings my interest in research.
That's where you fell in love with research.
Oh, yeah.
Wow. Where are you from?
I'm from Congo.
And why Tulane? People at your level could have partnered and went anywhere, but you stayed with Tulane. A lot of folk, once they graduate or go through an institution, they look to go someplace else. You elected to stay.
Yeah, for me, Tulane was a great place.
That was the place for you.
Yeah, that was the place for me because they have many research going on, and it was the right opportunity for me. When I graduated, it was the time the pandemic hit, and many research-related COVID was happening, right there, and it was a good opportunity for me to jump in. And since my master degree was focused on infectious diseases. So I was like, this is the right opportunity for me to jump in and,
And nothing against you, but I can see you're a little more seasoned than Blair here. How long have you been doing research, and how long did it take you to get to the level of a research specialist or research coordinator?
Yeah, I started, like I can say, since 2019. Yeah, and by that time, we were first of all going into community to talk to people, to bring people into research. And after that, a couple of months later, I started to work in the Clinical Translational Unit where we are working right now. And yeah, that's when, I was really, I went deep in research and to understand more about, how to conduct research.
Now, you talk about infectious diseases, and we have no shortage of infectious diseases here, especially the way they attack Black folk and Black Americans here. What was it about infectious diseases, though? Because that's sensitive and potentially dangerous level of research. What was it about that, though, that made you say, this is the, and then now COVID? We know there are many researchers and medical people who've become victims of COVID, but you choose to stay in that area. Why?
Yeah, because I'm coming from, Africa where we have many tropical diseases. And I kind of have some good understanding of infectious diseases. We have diseases like malaria, tuberculosis, and for me, COVID, it was a respiratory diseases. I'm like, okay, it's better, to start, to help also with some knowledge that I had.
And RSV, respiratory syncytial virus, it sounds like something, from a whole nother planet, but its relationship to COVID, and we hear so many people talk about their respiratory system.
Yes.
Talk about that part of it, please.
So I can say that RSV and COVID, they are both respiratory diseases, and they have similar symptoms like cough, runny nose, sore throat, and when you have it, you can have fever, difficulty breathing, and I can say the only way people can make a difference between RSV virus and COVID is to get tested, and this is the only way people can know that they have either RSV or
cultural
COVID.
Differences and disparities and deficiencies. Blair, we don't usually get tested, and what Flores has said, one of the keys is getting tested. Talk about, especially with RSV, in many of the other areas that you guys are researching. Why is it important to get tested? And how do you begin to implore or encourage African Americans to go get tested?
You have to know. You have to know what's going on with your body. A lot of us, and I've been guilty of it as well, we get a little cough, a little sniffle, and just brush it off. But I feel like in today's world, with COVID being a huge thing, and now with RSV coming to the forefront, we have to be more proactive. And even if it's just something little, it's better to be safe than sorry. So it's better to, just go get the test done. It doesn't take long. And then you get your results back fairly quickly, I would say.
Then you go get healed.
Right, exactly. You get healed, or okay, it is just a cold, and I'm good to go.
Get healed or die. Is RSV new?
No, RSV is not new. RSV has been there for a long time. I think
with COVID, it's just brought attention to it.
Yeah, because people usually get mild symptom about it. But the thing is, elderly people with underlying conditions
65
like
and plus.
Yeah, 65
why are
and
you
plus.
looking at me like that when you say elderly people, Flores? Hold on, I ain't that old.
Yeah, 65 and plus who have underlying conditions like chronic respiratory diseases such as COPD or congestive heart failure So those people, whenever they have RSV, they usually get hit like hard. They can have severe symptoms or life-threatening symptoms. And actually, the CDC recorded like 177,000 hospitalizations due to RSV and 14,000 death related to
177,000 hospitalizations.
Yeah,
and
14,000
deaths
each year related to
every year.
RSV. Yeah,
this isn't anything to play with, Blair. And the number one thing that I'm hearing from people, especially who experience COVID, and you guys have already said that RSV is not new. It is a debilitator and a killer if not dealt with. But people are really talking about their respiratory issues following COVID. And I know he doesn't mind. Our great producer here in the studio, his battle with COVID left some lingering results. He seems fine now. But and many other people, they're trouble breathing. Got to deal with that right away.
Definitely. I've heard the same things. I had COVID as well, and I was fortunate enough not to have these long-term symptoms.
Right.
But the long-term symptoms are definitely being looked into. And what's causing that to happen? Why aren't people fully recovering from COVID?
And that's what the researchers are doing.
Yes.
So, Flores, when folk talk about long COVID, RSV is one of those outcomes, byproducts of long COVID.
Not at all. There are two different
things.
Yeah, two different things,
and
two different virus.
And quickly in a minute, and I think that's important because some people think it's the same. RSV is one thing.
Yeah,
long
thing.
COVID is a whole other thing.
Yeah, it's totally different.
Hey, man, that's why we got our researchers in the studio, man. We're going to take a break, guys. But when we come back, we'll talk to Flores and Blair about the medical community, man, continuing to engage in this area, their relationship with Tulane, RSV, getting tested, and how we need to come together around this level of wellness. Tulane, Flores, Blair, WBOK and Equity Media. We'll be back after the break with this bright moment. We are back, 23 minutes past the bottom of the hour. We're going to continue this fascinating but important discussion about RSV, respiratory syncytial virus, and other studies in clinical research that Blair Williams and Flores Numbi are doing. Flores K. Numbi is clinical research coordinator at Tulane University, and Blair Williams, homegirl, is a clinical research nurse. Flores, if we could talk about what makes clinical research so important for all types of illnesses, and like we said earlier, that clinical research person is usually in the lab. No one gets to see them. But it's not just this. You guys set the table for cures and for how we cope with varied amounts of illnesses.
Yeah, I can say clinical research is really important because it brings more information that is necessary to make like advances in medicine, and it helps physicians to offer new treatment to their patients that work better with their conditions. And we need research to understand how the body works and how and the outcomes of many diseases. Yeah,
and you guys are working on some research right now in some very sensitive areas, right?
Yeah.
You can give us some insight and open the window into your lab right now.
Yeah,
what are you working on?
We have many researchers going on at Tulane. Like right now, we have more than 30 active research that are recording, and more than 50 research going on.
30 active
recording.
Recording, right?
Yeah,
right
recording
now.
people, to participate, and more than 50, research where we are following up people. And
so, what is COVAL?
So, COVAL is one of the new study that we started recently. It's a NIH granted study, and we are trying to see. We have many variants going on with COVID. Actually, we have Omicron, we have Delta, and we never know because virus usually mutate. We never know. Maybe we can have another mutation coming up soon. But what researchers are doing, they're trying to go ahead and try to see if whenever mutation we can get, if by combining the variants that we have actually right now, by combining them, if it's gonna help to control like not only existing but also emerging variants that will come up with COVID. So it's a COVID research study, and we are giving another dose of vaccine.
Now,
COVID
one of the
vaccine.
notes we have about, especially from COVAL and the RECOVER study, is patients who've had COVID within 30 days suffering from long COVID, the residual impacts from contracting the virus. We talked about that, a little bit about those residual effects that many people are still dealing with now.
Oh, thank you for bringing that. This is a new another study that we are doing at Tulane. It's called RECOVER. So we are trying to understand, with the RECOVER study, why some people get longer COVID diseases. They are sick longer than other people. It's a U.S. multi-site studies happening, and we are recording people who were infected like 30 years ago, or people who have like a sequela of COVID.
But before we get to Blair, I really want, because you guys are doing a great job of making, except for when Blair went on about genetics and all that other stuff early on, she kind of flew over my little head here. You guys have really made this digestible and put it in layman's term. I want you to walk folk through the research lab. COVID, RSV, long COVID. You're in with your research team. You're coordinating it. What is that beginning? How do you guys start to say, you know what? Our team is going to research this. We're going to start the work. What does that effort look like, Flores?
So to start like in research.
Yeah.
So I think that's depends on what we have in a setting, because research usually focus about in like whatever diseases that they have, right there. The whole goal is to try to figure out new ways of stopping the progression of disease.
So take somebody into your lab. You're trying to figure out RSV. You're trying to figure out those residual impacts. What do you do first?
Oh, yeah. First of all, as you know, for research, people who join, they are volunteer. We have, first of all, to consent them to take part in the study. Then after that, we have a couple of tests and a couple of questions that we ask them. And after that, we're going to check, the samples to see the impact, like for the RECOVER study, the impact of COVID within their bodies.
See, that was an important question. But see, Blair, I had the first thing you do is you put on your glasses and your hat, and you put on the white coat and your gloves, and you get a microscope, and you get a little sample, and you put it under the microscope, and you have all the little complex equipment, and you just clear it and say, you start with the people.
Oh, yeah, that's correct.
See, we got it all wrong, right? And so, all of us study, right? And everybody's a researcher at some point. But talk about the research you do when he starts with the people, gets the sample. What's next after that?
So the All of Us study is kind of different. We're not so focused on a specific disease like RSV or COVID.
But we're all included, no matter what you think or not.
Right, we're focused on
citizen,
everything.
Everybody.
Everything.
Okay.
Yes.
See, I never would have thought that. I just thought it was y'all smarty-arties in the lab, right? Using big words.
I mean, you're not technically wrong. I feel like there's two different parts to research. So that's one part what you're describing, and then our daily work is more of the clinical part. So it's kind of just like going to like a doctor's office for a doctor's visit. And that's where we do all of the surveys that Florice mentioned. That's where we'll take like blood samples or urine samples, whatever needs to be done for the study. So it's like just going to an office visit.
You say that, Blair. I'm looking at you, and I mean, you came in here shy. And we're talking to Blair Williams and Flores K. Numby, research coordinator and research nurse at Tulane University of RSV, long COVID, and other research effects from viruses and diseases. But when you start talking about research, right, you light up. This is potentially some dangerous stuff. Mm-hmm. You're taking a look at things that not only negatively affect people's lives and debilitate them, but at the end of the day, kill people. What excites you about this?
I think it's the part of finding something to treat or cure a disease that's negatively impacting the lives of people in our community. There are risks to anything. But the outcome that could potentially happen, I feel like is a much better benefit. And that should be focused on. And with these studies, we have a lot of regulatory boards that oversee us. Mm-hmm. So they're not ever going to allow something that's going to cause too much harm to any patients. So with that being said,
I'm just letting them know that was my next question.
Oh, okay. I think, like doing this and having these oversights to make sure that everything is being done in the correct manner.
And tell people we're not guinea pigs, right? And first of all, Flores.
Yeah.
Thank you for starting with people, because most of us think, man, y'all start with some outer space lab stuff. You start with human beings, right? And human beings are so reluctant, in many cases, to take part in these studies. Say why it's important for us to participate.
Because we want to know how our bodies work. Everybody's body does not react the same. Mm-hmm.
And you're not
especially to medications. You're not a guinea pig.
This ain't the Tuskegee's.
It's definitely not. It's definitely not. There have been so many things put into place to prevent that from happening again. And to protect us as everyday people who choose to partake in these research programs.
And walk that potential participant, because this is important, guys, especially what we're dealing with the unknowns around COVID, long COVID, and RSV. Walk that person who's listening right now, who needs to participate, who may be reluctant. How does the process start? And what do you take their brain, their heart, their DNA? What happens?
No major surgery. No organ donation.
Right. You're not gonna lose your eyesight.
So the first thing with any study, what we do is we tell you about the study. We tell you what we're looking into, what the study consists of, what tests, lab work we're going to do throughout the study, how long it lasts. And then, during that time, a lot of people ask us questions that we answer to like the best of our ability. And that's kind of known as like the consent process. So we want to make sure that you know what you're getting into. And that you have like a good understanding of what you're signing up for and what we would expect from you as part of like participation in the program or any other study.
And there are some rewards from studies, man. When people help, if you're willing to offer your time and your body, then I know a lot of times I've been part of studies before on my knee where there was actually a benefit and actually financial benefit, a stipend. Mm-hmm. Yeah.
So we do compensate you for your time. We know having you come in for visits. Sometimes you may have to take off of work, come into the downtown location and having a park. We take all that into consideration. And so we do provide a compensation. Compensations vary from study to study. But that definitely does happen because we appreciate you. We appreciate you helping us. Because without y'all participating, we wouldn't be able to get the data that we need to see if something's effective or not.
Wow, that's been a wealth of information. RSV, RSV, correct? Long COVID, COVID, the Recover study, what it means to be, a patient or someone who participates in the study. So for those who may want to call, give us a call at 504-582-9422. Guys, this is extremely important. This is why Flores Numbi and Miss Blair Williams and Tulane are teaming up to share this information. It's about our lives and how we deal with coming out of this over 2 year trial and ordeal that we've dealt with COVID. Flores, other studies that involve common illnesses that people suffer from that you guys are working on? I think y'all have something called the fractal study?
Yeah, we have the fractal study, and Blair can elaborate more about it.
Mm-hmm.
And yeah, it's mostly for diabetes people.
Oh, and Lord knows we got a lot of diabetes.
A lot of diabetes, yeah.
This is diabetes alley.
Mm-hmm.
Yes, it definitely is. So what Fractal is looking into are patients who have specifically type 2 diabetes. And the goal of it is try to eliminate the need for insulin, or decrease the need for insulin. I'm pretty sure insulin is something that people don't enjoy taking, having to stick themselves on a daily basis. So they're trying to see what else can be done to treat these people who have type 2 diabetes.
And what else can be done?
Well, so they're looking into specifically a procedure that kind of focuses on resurfacing of your duodenal mucosa.
I
know.
There she goes. There she goes again, Flores. All right. Come back to earth, please.
I know. So basically, it is just giving you a new, healthier layer that is supposed to help your body better respond to insulin. So if your body's responding to insulin better, it will decrease the need from you having to give yourself insulin.
Wow.
So that's what it's looking at. It lasts for about 1 or 2 years. They're looking for people between the ages of 21 and 70 who are currently taking insulin and have type 2 diabetes specifically.
So what is type 2 diabetes? Explain to people, because there are different levels of diabetes. Break them down for us.
So you have type 1 and type 2. So type 1 is when your body is not producing insulin that it needs. And type 2 is your body produces insulin, but over time, depending on what we eat, our physical activity, our body stops responding to the insulin that we're producing, or we're not producing enough insulin to keep up with the needs of our body.
Guys, we're in the studio with two of the leading researchers, Mr. Flores Numbi, Clinical Research Coordinator at Tulane University, and Ms. Blair Williams, Clinical Research Nurse and our home girl about RSV, respiratory syncytial virus, the effects of long COVID, the COVID study, the fractal study, and the work that they do in the research lab. Give us a call, 504-582-9422. I know you guys are listening, but if you have any questions about how your body is reacting now, you have two of the leading researchers at Tulane with this study that can tell you what you can do. Flores, even if maybe you may want to be part of these trials or studies, correct?
Yeah, correct. And for example, me, I took part at the Recover study because they are also recruiting, like they have a limited number of people who never get COVID. Like me, I never got COVID.
Hold on. Wait. You what?
I never got COVID.
Wait, touch me, man. I'm rubbing some of that all.
I've been testing myself like every week during.
And you're in the business of being
pandemic.
Around the disease and being around people.
Oh yeah.
And you have not. You sure?
Yeah, I'm really sure. Because
he said.
He's
not just sure, y'all. He said he's real sure, Black.
Oh yeah. Yeah, because at Tulane during the pandemic,
And
we
as
were
a
getting,
researcher, you have to get tested all the
yeah,
time.
yeah, we were getting testing like
Right.
all the time, like every week, every month, and like even right now, each month we need to check ourselves.
Blair, have you had COVID?
I have. I
Okay.
had it about a year ago. Actually, I think I got it from one of the patients who I was working with. So,
Yeah.
but yes, I have had it. But no long term symptoms, thank God.
Uh-huh.
Yeah.
Thank God. Guys, 504-582-9422, Flores K. Noonby, Clinical Research Coordinator at Tulane, and Miss Blair Williams, Clinical Research Nurse. Flores, you mentioned earlier the negative impacts on older people.
Yeah.
So if there are older people who are listening out there, if the quality of their life is being affected, this sounds like something they should do. Talk to them.
Yeah, the advice that can give to other people is, to be aware that the RSV vaccine is there, and for those who have underlying condition, they need really to be careful.
And to help us out there, what are some of those underlying conditions?
So we have people who, has asthma, who has chronic respiratory diseases like COPD, and people who have COPD.
Okay.
Yeah, COPD.
What is that?
Congestive obstructive pulmonary disease.
Okay.
Yeah.
All right.
And people who have, other diseases like, who suffer like from pneumonia. And the fact is, RSV is dangerous because it can lead to severe conditions like pneumonia. And that's why they need really to be careful when, they are around people who have cold-like symptoms.
Now,
might be RSV.
Now, we had a lot of people who've come through COVID and other diseases, Blair, in Flores. And just like we mentioned earlier, the reluctance, especially of the African-American community, folks seem to be reluctant to call. I know they're listening, though. How important is it to check in with your healthcare provider and your doctor, no matter how you think you feel? And, you're a researcher. But you get checked.
Yeah.
You guys make sure that you do your health checkup. How important is it to get a full assessment, man, especially and to understand flu season versus COVID, especially given where we are right now, encouraging people to engage their healthcare providers?
Yeah, so I can speak on that for sure. I think from a clinical standpoint, it's very important to stay on top of your health. I know sometimes it can be kind of cumbersome to get out there.
You got to take time. Stop what you're doing.
Yes, you do. You definitely
just to save your life.
A yearly checkup, and that could prevent so many things from happening.
Mm-hmm.
The doctor can catch something that's going on and address it then, and stop it from turning into something like diabetes or high blood pressure. Getting in there and attacking things early on can change the lives of everybody, really.
Flores, go see, get a full assessment. So what would you call a full assessment?
So a full assessment, whenever you see your doctors, they do like a physical exams, and they collect your samples to see if you have any kind of diseases. Yeah, there are certain number of diseases that they usually screen for whenever you go for your annual. They screen if you have any type of infections.
So I'm listening. I'm thinking about this. I'm representing folk who are not calling. But if you want to call, guys, call in now because we're going to be getting to the end of this very important segment at some point. 504-582-9422. I want to be part of the trial of the study. What do I do?
Yeah, so At Tulane, we have what we call a voluntary research registry, and this is for people who want to participate in research.
Okay.
And yeah, whenever you go, you can Google it. If you Google voluntary research registry, you can provide us with your informations, and we have a couple of questions over there. And whenever we have a research where you can be eligible, we will reach out to you. But also you can reach out to us, to our clinic. We can provide our phone number, that is 504-988-0200 or 504-988.
Blair, everybody's usually not accepted when you go to do research, though. There are some people you may want to be part of the study, but you got to qualify to be part of the study, right?
Yes.
So who's not eligible?
That varies depending on each study. It varies study to study, honestly.
The study to study studies?
But let me tell you, one study that, I'm really excited about that we have going on is the All of Us study. And almost everyone is able to participate in that. All you have to do is be 18 or older, a resident of the U.S., and you could be in the study.
One-time visit?
One-time visit. You come into our downtown location. We take one set of blood samples, a urine sample, and after that one-time visit, all you have to do is get on your phone or your computer and fill out some surveys for us about every 3 to 6 months. The exciting thing about this study is that we are building a huge database for future research programs, so it's kind of helping the generations that are coming up behind us and helping their health. And, they really want to get all of the underrepresented communities involved.
Right. I like that, the All of Us study.
Yeah, because a lot of us, our information is not included. So how our body reacts to things, we don't necessarily know. Many people have symptoms of different medications like constant nausea or headaches, and we have to look into these things to figure out why this is happening. But they can't look into it if they don't have our information.
As a research coordinator and leading researcher, Flores, cultural, racial, gender differences matter in research?
Yeah.
Especially when you talk about people of color and those descendants in our community?
It's really matter because whenever we do research and we want the samples that we have to represent the population of interest. Like if within the U.S. we know that the minorities are like 40%, and whenever we recruit people for research, we want to have that representations. We want to have at those 40 people to participate in research.
Well, let me ask you this, especially as a coordinating researcher, and I think I know what the answer is. But with these efforts and these studies, even with all of our disparities, even with people of color, Black folks specifically, leading the way in chronic illnesses, it's tough to get us to participate, isn't it?
Yeah, it is tough, as Blair said, with everything that's happened in the past. It's really, really tough. People, sometimes they don't have trust, within, the research, and some of them, they are maybe really sick, or they have many barriers that don't allow them to join research.
And this is gonna sound crazy, but Blair, I think it makes sense, And some of them are afraid they're about to die, but that's why you need to go.
That's why you need to go to the doctor.
That's why you need to maybe participate in the research, right? But Blair, being an African American, coming from a medical family, historically, man, getting Black folk, especially in Louisiana, man, we lead the nation in most chronic illnesses.
Yes.
Here, go get checked. Be part of the study.
Yes.
And Blair, being part of the study, I think you touched on it earlier, allows us to be part of the solution.
Yes, definitely. There can be no solution for us if they don't know, how our body reacts to things. So the best thing we can do is really get out there and start participating and really becoming involved in research.
Wow. 504-582-9422. We got a couple minutes left. First of all, thank you guys. I think y'all have made some complicated stuff, man. I never would have known what respiratory syncytial virus was and all of those big words, Flores. You may be the research coordinator, but Florence got that medical book down. I mean, Blair's got that medical book. You got to feel proud of seeing young researchers like this following your footsteps. Flores.
Really appreciate it.
How difficult is it, guys, on another topic, to get more people of color and more black folk in the medical field? I think only 4% graduate in the field. I think one of the things we have to do is get more Flores, K. Nambes, and more Blair Williams. Correct, Flores?
Yeah, that's correct. By having minorities will bring more trust to people of color or other minorities to take part of research.
Flores, we got a couple minutes left. I'm gonna let our future leading research coordinator close us out, but bring us home. What do people need to do, and why is this study and why is this effort with you, the researchers in Tulane University? Again, why is it important?
Yeah, it is important because we need, whenever a research is going on, whenever we are studying to see if drugs can cure disease, we need everyone to take part because our body works differently. People from different race can be impacted differently when they are taking a specific treatment. That's why when we are conducting a research, we need everyone to take part.
And homegirl, bring us home here, man. This research study, whether it's all of us, Facto, Covale, the research all are doing, and where do people reach out? Who do they call? And how do they get in touch with you?
Yes, so I know we've mentioned a lot today, but definitely give us a call. We have two numbers, 504-988-9801, or you can give us a call at 504-988-0200. We also have an email if you like to email. It's ctu@tulane.edu. Give us a call. Let us know if you're interested in research. If you don't know what research study is best for you, we can always help walk you through it and get you connected with the right research study for you.
Well, if there's anything I've learned from this Tulane team, from the great Flores and the great Blair, is that, there has to be research, and there has to be people, and there has to be people who come forward, or there can't be cures and solutions. Thank you guys for what you do. Guys, everybody have a great weekend. Let's not forget about the DEPA meeting on Monday at 8700 Lake Forest Boulevard with Norman Barnum and the great Joanne Lawrence from SBA. And Fit Fest, man, the 1800 block of Agriculture Street with Earn That Body. Come out, get healthy, get fit with special guests, Trainer for the Stars, Dwight Holt. That's this Saturday at 9 a.m. And the Bunny Friend Family Fest, where we'll be honoring the great Cess 4-5 at Bunny Friend Playground. A lot of stuff happening Saturday. Let's get involved. Stay healthy, stay well, and stay woke. Front Porch coming up next. Yeah.